Dear colleagues, thank you for joining us once again for round 5 of the OncoAlert Roundtable discussions. These roundtables were incorporated by the OncoAlert network to bring the scientific community a little closer together and share what we know about the COVID-19 pandemic, especially regarding our cancer patients. This roundtable is a little different as we highlight the ASCO 2020 meeting, which because of the COVID-19 pandemic was held as a virtual meeting. Through the great efforts of ASCO and their team, the meeting was held 100% virtual and streamed throughout the globe with amazing success. Such a feat was not a simple one, and many great colleagues and ASCO staff worked very hard to make this meeting possible, and to them we are very grateful. Today, we are honored to have great colleagues from the American Society of Clinical Oncology as discussants, and we will be talking about the meeting, its challenges, the scientific program, the educational program, social media, patient advocacy, and what ASCO has in the works in terms of education. So without further ado, it's a great privilege to introduce to you the discussants for this roundtable. Our esteemed guests are Dr. Skip Burris, previous ASCO president, Dr. Melissa Johnson, ASCO Annual Meeting 2020 Scientific Program Committee Chair, Dr. Tatiana Prowl, ASCO Annual Meeting 2020 Education Program Committee Chair, Dr. Dawn Deson, editor of ASCO Education Book and member of OncoAlert, and Dr. Taufik Owonikoko, ASCO Annual Meeting 2021 Educational Program Committee Chair. Your co-host, Dr. Felipe Ades of Brazil, and myself, Gil Morgan of Texas, residing in Sweden. I will be your moderator. We have chosen a set of questions and topics which the discussants have had the chance to look at and have had time to prepare the response. The moderator will be presenting each question and choosing the order of the discussants in answering. If there are no further questions, let's begin. If we could start with Skip, can you give us a brief introduction about the meeting?
Yes, thank you so much, Jill. The opportunity to lead this meeting during this period of crisis was really amazing. A number of things that stood out and many of the panelists that we have today were part of the reasons for this great success, for all the planning that went into it. So we were about to start our face-to-face meetings when we made the pivot in late February, early March to realize this could be a possibility. And then a few weeks later, as the Army Corps of Engineers took over the McCormick Center for potential COVID patients and to support the Chicago system, it became a necessity to have the meeting virtually. We ended up having 42,750 registrants, which was a record by several hundred. Interestingly, we had 40,000 oncology professionals. We can talk more about that, but this was a record by a substantial amount. And I think this goes to the fact that there were no doctors left home to cover. We actually had everybody home and everybody able to participate. 138 countries participated, and I know I got numbers of comments from around the globe of folks who ordinarily wouldn't be able to afford to travel, or travel would have been arduous, and they were actually able to participate in the meeting. We had over 5,000 abstracts, about 5,300, which is kind of where we've been the last few years, steadily increasing by just a little bit. 109 live and on-demand sessions, but more than 2,300 recorded presentations, which is interesting because for the first time, the poster presenters actually were able to give a brief bit, 2 or 3 minutes about their poster. And I know that was something we also received a number of compliments about. So that was very intriguing. Folks were bouncing around, looking at a variety of different sessions at any given time. I think using more than one device, which resulted in us having almost 3 million views of meeting content. So that was also an amazing number. Something that we quickly figured out on Friday afternoon, and I think over the weekend, Saturday and Sunday, a much better IT experience. So all in all, with the help of the leadership on the call today, with the ASCO staff, I got to call out Dr. Jamie Von Rowan's educational and science team, who were just amazing pulling this together. I think we set a standard that now, as we get the comments rolling in, folks around the globe are going to want to see some element of virtual ASCO, if not simultaneous virtual and live, depending on how things go over the next few years. So again, I'll wrap up by just saying successful beyond our wildest imaginations, and the positive comments outweighed the negative comments by 19-1. So it was really a great experience.
Thank you so much, Skip. Yeah, we had a great time. I was just discussing with Felipe that this was really an amazing meeting to have the possibility of being home. We were all very worried because the ASCO is a big part of the year, and to have it threatened by this pandemic and have the possibility to still have it go on was amazing. So kudos to the ASCO team. It was a wonderful thing, and on behalf of oncologists worldwide, a big wholehearted thank you. And we would like to follow up with Melissa giving us an overview of the scientific program.
Sure. Thanks, Gil, for inviting me to participate today. It's really fun, actually, to think about an after-action report. We haven't had that opportunity this week. As I think back over the sessions, in particular the plenary and the 3 special clinical science symposia, Skip's right, they ran unopposed, and I think by contrast to other years when we're all tempted to schedule networking opportunities and one-on-one face-to-face meetings during those times, I think everybody was able to participate, and so I hope everybody has an opportunity to watch those sessions in particular, because of course they were featuring what we thought was the top science, the top abstracts of the 2020 meeting. As I think about it, the motif throughout those sessions was therapies that were established in other arenas that were finding new indications or were being used in a smaller subtype, a more rare tumor type or a molecular subtype. Here are some examples. First, in the plenary, we had 2 examples of immunotherapy being used in new indications. Javelin 100, presented by Tom Powles, looking at maintenance of avelumab after frontline platinum chemotherapy, prolonged survival for patients, and in particular patients that were PD-L1 positive. So that will be a new indication for avelumab for those patients, a new place where immunotherapy is being used. Likewise, the Keynote trial for MSI-high colon cancer, the immune therapy, in this case pembrolizumab, being preferred over standard frontline chemotherapy for these patients with colon cancer. So again, a new indication, a new opportunity for these patients. And then I might turn to one other abstract in the plenary, the Ad Aura abstract, looking at osimertinib, an EGFR inhibitor for patients with EGFR mutated cancers. This was a trial that looked at osimertinib in an early stage patient population. The primary endpoint that was reported was disease-free survival. It was largely in favor of patients who received osimertinib. 0.2 was the hazard ratio. And while there's been some healthy discussion on Twitter about the overall survival results, which of course are several years away, this to me was an example of using a targeted therapy potentially for goal of cure for patients with early stage lung cancer. And isn't that a fantastic win for our patients? And those are 3 highlights for me. There's some others that I know would like to comment.
Excellent. Thank you, Melissa. Skip?
Just to add to Melissa's comments there, and just to be fully transparent, the angst of every ASCO president is, are folks going to show up to your meeting, and is the science going to be compelling? So Tatiana and Talfik will talk about the educational program, which we have a lot of control over. And it's going to be fabulous in August, but you have to rely on our colleagues and researchers for what's going to get presented at the meeting and submitted. And there's always fear about that. And it was just stellar in terms of the breadth of presentations, the quality of the research. It just shows you that with all the success we've had in oncology, there's still a long way to go. And there were very timely topics that generated great debate, which I think is the ultimate compliment.
Thank you, Skip. Dawn?
Yeah, I compare the experience with this ASCO to last year when I tweeted out from the hall where plenary occurred, and it was, there was this enthusiasm of being in the hall and tweeting and seeing what other people were doing. But what I found so significant about this meeting and where we really took advantage of it was the discussions were just so much more vibrant, I think, with this one. And I think it's because we were all in a place where we could really think about the data and not have sort of quote unquote this noise around us in the hall. And we could really listen in on how people were looking at it. And I think the more important thing is this meeting really allowed patients as well as their advocates to join in the conversations real time. And I think the osimertinib data is one very good example of how those discussions were so incredible during the meeting, but they're continuing even right now.
Thank you, Don. Tatiana?
Yeah, I just wanted to comment on the opening session, which I thought was so lovely. And I expected that it would be so lovely, but it was so much more special considering that we were in the midst of this pandemic. So Dr. Burris gave beautiful remarks and a sort of a historical look back. And then David Feigenbaum came in with this, very modern perspective on how patient advocates can be right at the center of drug development with his own incredible story of illness and developing an advocacy organization and funding original research that has left him, in good health at the moment, and we hope long term. And so I thought that story was so beautiful, and the fact that his laboratory has pivoted to work on COVID-19 because of a scientific connection in terms of cytokine release syndrome just felt so of the moment. It felt planned, and of course, when Dr. Burris and I first discussed him as a speaker, which was a long time ago, this virus didn't exist yet as far as anyone knew. So of course we couldn't have known this, but it just felt like it could not have been any better timed. And I think that for anyone who missed that talk, it was just, it was phenomenal. I've gone back and watched it a couple of times myself already, and I was already familiar with the story. So I would really encourage anyone who missed it to go back and watch it. I was worried that one of the things we would lose with the move to a virtual meeting was that sense of connectedness and shared celebration. And we have that in every meeting, right? There's always at least one, but sometimes several abstracts where you just sit in the room and you think everything that has always been true just changed in this moment. In breast, we still remember the adjuvant Herceptin moment where everyone gasped and there's this standing ovation, but there's some moment like that or multiple moments like that at every meeting. And you just worry, will we still have that sense of shared communal victory that keeps us going when we go back to work after the meeting? And I felt that with David Feigenbaum's presentation. I just felt like, okay, we're winning. Like we might all be sitting in our houses watching this in loungewear while our kids need stuff in the background. And this is nothing like what we thought was going to happen, but we're still winning. So I thought that was so inspiring. You should go watch it if you've missed it.
Thank you, Tatiana. Melissa?
Tatiana, I agree so much. I think I had chills during during the whole opening ceremony. That connection was palpable. The other place that I felt it, to Don's earlier point, was in the drug development CSS, how to develop a drug in a rare indication. For those of you that might not have watched that, it was before the plenaries on Sunday morning. I'd encourage you to go back and review. And it had three great abstracts looking at RET rearrangement, patients treated with the RET inhibitor, Blue 667, selpercatinib. They were non-lung RET fusions. We had entrectinib for children and adolescents with ALK, ROS, and NTRK rearrangements, including patients with brain metastasis. And then Phoenix, looking at the FGFR inhibitor futibatinib for intrahepatic cholangio. So very small, tiny little subtypes, if you will, or rare indications. But I think the seam through that CSS was in the discussants. We had Lily Petrozelli from Pharma Biotech we had Steve Lemery from the FDA, and we had Mark Lewis, both who is a patient advocate as well as an oncologist. Many on Twitter will know him. The electricity that David Feigenbaum generated in his presentation was also present in that session. Steve Lemery shared his journey as a cancer patient as well as a regulator, and Mark his journey as a patient as well as an oncologist. And I think it did drive home the message that we are partners, oncologists in the field that are helping move this field forward, but rather patient, regulator, pharma biotech, and patients all together. And there is shared knowledge and wisdom that we all bring. And that to me was the theme of the meeting. It was alive, and it will forever be my the capstone for me.
Thank you so much, Melissa, and thank you, everyone. That was a great wrap-up of the scientific program. And of course, congratulations. It was such an amazing and beautiful job that you guys did. So really, kudos and a heartfelt thank you. So now moving on to the next step, which is the educational program. So what is in store for all of us in oncology coming from ASCO? Tatiana, you want to get us started?
Sure. So, I said to someone else yesterday that I was both grateful and worried to go after Dr. Johnson with the scientific program. Grateful because all the bugs had to be worked out already. I think we have a better handle on some of the technical challenges and the fact that we should expect, really tremendous traffic to the website. So I'm grateful to Dr. Johnson and Dr. Burris for sorting that out in the first half of ASCO 20. It's hard to follow that act though, because it was so successful. And one difference between the scientific program and the ed program is that the scientific program retained all of its original content, even though the presentation of it was different. So, there was the broadcast sessions and then the on-demand material. All the posters were there. So 100% of everything that was expected to be presented was in fact retained in the scientific program. I guess maybe apart from, I don't know if anyone had to back out just because of, challenges of COVID and recording a presentation or something, but certainly virtually all of the expected content was there. We couldn't do that with the ed program. We have about 75 or 80% of the content from the initial planned ed program is going to be retained. So we do lose some of it. And I will be honest with you that we lose some of the things that I was really, were closest to my heart, because some of the things that we're not able to do are the sessions that were panel-based and that we're going to be very dependent on real-time audience interaction for technical reasons, and just to ensure that we wouldn't get caught up with a glitch and get very far behind or something. We made the choice for both the scientific and educational program to pre-record all of the content. And I think that given what happened with the traffic to the ASCO website on the scientific program, it's clear that that was the right decision, even though you lose a little bit of the live nature of it, if you will, and maybe some of the chat that's going on feels a little bit less necessary to be in real time because things are recorded. But nonetheless, I think it was the right decision to pre-record. So what this means is that the sessions that were dependent upon audience engagement and a lot of back and forth between the panelists kind of riffing off of that were things that had to be removed from the virtual ed program. And the other things that had to be removed were things like ticketed sessions, which again are really designed to be sessions that are very dependent upon this intimate setting in a room with a conversation. But everything else is there. And so we have, a mix of both broadcast and on-demand material. We have a lot of sessions. So certainly all of the standard educational sessions were very easy to retain, where you have 3 speakers, each giving a didactic presentation. There will be some panel discussion or more interactive sessions that will, again, be pre-recorded, but will be occurring. And we'll have the chat open for those, so that we're hoping to have all the speakers and the original chairs of the sessions. Of course, we didn't need a chair in the sense of introducing people because of the format and the pre-recording, but we're hoping to have all the speakers and the chairs be present in the chat during the education sessions that are airing in real time. And, I tend to be, I think like most oncologist, you know, a glass half full or 3/4 full kind of person. And so I think that's actually really interesting to be able to be watching the presentation in real time with the presenter and be able to ask them a question in real time. That's exciting. You can't normally do that. Normally all the presentations occur, and then, you know, after 2 other people have spoken, maybe you were left not ever having had a chance to get to the front of the microphone line, or maybe you didn't have the courage to go to the mic at all. And I think that you may see a greater engagement, or a different group of people engaging on the chat to ask a speaker a question than you would maybe in the room. So I'm excited about that. I'm very excited about some of the content, which we cover things that I think are obvious things that ASCO 20 needs to cover. We cover things like addressing resistance to immunotherapy and resistance mechanisms of targeted therapy and so on. We cover all of that sort of content that you would expect, but we do have some topics that we've not had covered before. We have a topic on competency for LGBTQ patients that has different material than we've had before. We have a topic about sexual health and reproductive issues in cancer survivors that I think is going to be really important. We have a session on cultural competency for taking care of active duty military members and veterans. That is a topic I've never seen covered in any oncology meeting to my knowledge. And so I think that, you know, one of the things that was very near and dear to my heart, and Dr. Johnson, Dr. Burris, as we're all military or former military or military spouses, was thinking about that group. And so I think I'm really proud of that session. I think it's going to be great. And we will also have some material related to COVID-19. You know, that certainly was not anything we anticipated, but there have been really major impacts of COVID-19 that I think it's critical for us to address. So impacts on trainees, you know, many of whom now have been not in their training program for months, or have had their laboratories closed down. And what impact is that going to have in terms of their educational experience, and importantly, in terms of their readiness to be attendings? I think we're going to have to contend with that, because it's pretty clear to me this isn't just going to go on for a few months. We're going to be at this weird, you know, distanced learning with a lot of things that we're normally able to do not happening for a while, I think, until we have a vaccine. And so at some point we're going to have to start thinking about, what does this mean for training? What do we have to, how do we have to change this? Do we even have to maybe lengthen training? I think we're going to have to start contending with all those issues. And then about COVID-19 and impacts on research in terms of clinical trials, which obviously has been dramatic. We've seen a huge drop off in enrollment of clinical trials, many clinical trials that were halted outright. Many patients who are scared to go even get care, and the impact that has had on cancer center budgets, and really importantly, the impact that has had in the community practice setting, where many practices have been at risk of closing because of the need to buy, you know, continue to keep the lights on and buy medicines and so forth, but without the usual incoming revenue of patients not coming for treatment. So I'm very excited by this. I think we've done a good job of responding to the challenge that COVID has presented to all of us. And I think that all the content that you could have expected to be there will still be there, minus these really important interactive sessions. The last thing I want to say, and then I'm going to yield the microphone here, is that one of the things that we felt very strongly about with this meeting was that we wanted to have an increasing presence of patient advocates in the meeting. We wanted to attract them to the meeting in larger numbers, and we wanted to see them represented at the podium as our partners in drug development, and as people who are experts in their lived experience with the disease. And some of the sessions that had to be cut because of format prominently included advocates. So although we have many sessions that still include advocates, we don't have as many as we originally planned, and that is such a loss to me. So I hope that some of those sessions in some iteration, or some of those advocates may be able to be incorporated in future ASCO meetings, either in the subspecialty specific symposia or in the 2021 annual meeting.
Thank you so much, Tatiana. I think I speak for everyone when I say we're all really looking forward to this. It sounds wonderful. And of course, very grateful that ASCO is putting patient advocates first. And that's a wonderful thing. To follow it up, Tafik?
Yeah, I think, can you hear me? Yeah, I think Tatiana really summarized the whole approach to the education program. And my role at this point as the incoming chair-elect for the education committee is really to learn from Dr. Burris, Dr. Johnson, and Dr. Powell in terms of the lessons learned, switching from the face-to-face format to virtual format. Since we don't know what the whole outlook would be like a year from now, we actually have to start running two parallel tracks. Is this going to be face-to-face meeting in 2021? Are we going to have a full virtual ASCO meeting again? Hopefully not. But as we've learned that people really engaged very, very strongly with this virtual platform, I believe that going forward, we are going to have to offer some type of virtual opportunity for ASCO members worldwide to engage. We know that the 40, 50,000 attendees at ASCO does not, equate to the entire community of oncologists. So having people be able to engage from various parts of the world and different specialties is something that we have to build on. The other lesson that I learned from this virtual ASCO that we had is actually the ability to be nifty and respond to topical issues. I remember a year or two ago where we would have very important data come out and we say, unfortunately, the program is fixed, we really cannot incorporate anything else into the program. We see how we can build on the momentum of what is topical and important to the field, like COVID-19, for instance, where we just turn things around and we had a very, very super highly impactful session looking at the COVID pandemic and cancer care delivery. And not only was that session very, very impactful and engaging, it actually now led to so many other spin-offs of other programs that people are now engaging in. So, oh, wow, I never realized what an opportunity COVID brings for cancer patients and care delivery. And finally, one I would say is ASCO being a family and a continuum, there's actually a very, very, so to say, maybe accidental, but nonetheless very fortuitous linkage between Dr. Burris's theme this year, which is Unite and Conquer, to what Dr. Lori Pierce is trying to engage in, which is equity for every patient, everywhere, all the time. So I think we have this logical progression from what we focus on this year and how we want to translate that next year. So some of the educational pieces that unfortunately we may not be able to address given the short time that we have in retooling everything, we may be able to incorporate into the education program next year without missing a beat, since there is this logical connection between the two themes, between the two precedents. And I will stop there for now.
Thank you very much. Don?
Yeah, I think Dr. Powell really summarized much of it really well. Her committee worked incredibly hard to come up with these multidisciplinary topics and really be all-inclusive and really try to demonstrate how, you can do a breast cancer track, but there is synergy in other tracks as well. Fortunately, I think the education book will stand as a testament to all the planning that was done with the education committee, and as it was led by Dr. Powell and Dr. Burris, as well as Dr. Johnson. And what was interesting to me is coming into the meeting, the ed book stood in front of the education committee's work, which is sort of reverse of how it usually will go, which is we release all the content, simultaneously with the meeting and people attend the sessions, and then they fall back on the book as sort of, if a manuscript was there for enduring material. This time, I think it ended up being the reverse, and it really gave, sorry to say to Dr. Powell, it gave the education book a really great opportunity to shine on its own. And I think that was a really great opportunity because the education book content, not only is it a PubMed listed publication, but it's free. We've made this content free from content experts across the globe. And I think that is something for ASCO to always be proud of. But I think now people will now have the book to inform the content of the live education meeting that's going to happen in August. And I'm hoping that, yes, I think it will provide the platform for people to come in a bit prepared of what's going to be talked about. Granted, there will be some edits based on the 2020 meeting, But hopefully, if we all commit to being in the room when the presentation is going, if those authors are joining alongside people who are watching the presentation at the time, I'm actually quite hopeful, as is Dr. Powell, that there will be a very spirited and spontaneous exchange of ideas going on. So I look forward to it.
Thank you, Don. Melissa?
It's true, Don, that the thing that the chatter that we're used to having at the ASCO meeting was the thing that usually propels us then to the next step, and that's what we were missing. And I love the idea of new ways that'll be happening.
Yeah.
I did want to just circle back to the COVID and cancer session that the Clinical Science Symposium. We found that there is obviously the whole reason that we couldn't be together was because of COVID, affecting patients all over the world, but in particular, our patient population is so very vulnerable for a number of reasons. Not only were their immune systems potentially weakened if they were to contract COVID, but also their cancer care was potentially delayed, their treatments potentially affected. And so we thought it was really important to add that in, although obviously the abstracts were due right as things were heating up in Wuhan. I just wanted to give just a little celebration, shout out, if you will, to the ASCO staff that helped make that happen. We also wanted it to be a scientifically based session, and so registry data was what we had access to. And of course, for anybody that watched that session, you see that the limitation is just that it's a point in time for all of the investigators that added data into the database. And so we found that everybody was adding data at different points across the world. I think that's a rich data set and it will continue to grow and teach us things. But I think with a little bit more time, the education session this year, and certainly Tawfiq, by the time we're planning 2020, we'll be able to ripple and spread opportunities from that session further. But I did just want to mention that for all of the planning that's required, we did sort of turn on a dime for that one. And I'm proud of that one as well.
Thank you so much. We're all really looking forward to what's to come in terms of education. So this is going to be great. Moving on, as far as the advantages of a virtual meeting, besides being able to be walking around in shorts and t-shirt and watching the plenary, which I would not advise anybody to do so in real life. What else is there? So Skip, if you could start us off.
Yes, Gil, it was unbelievable. It started Friday morning with people immediately texting me that they love not missing anything. So not having to pick and choose between some meeting and what was happening in this hall versus that room. So I think that was the overwhelming advantage for the participants. I think not too far behind that, varied comments about the travel. So there were not having to travel to Chicago. There was not having to get from your hotel to the convention center. And then with the enormity of the McCormick Center, a lot of comments about not having to worry about, jogging from, Hall E to Hall B or whatever you need to do to get to your session. So very logistical things, but people like the broad access and the lack of feeling like they had to choose between sessions, and then just the simplicity of being at your home with the whole ASCO scientific program at your fingertips. Those are the two big advantages I'd put at the top of the list.
Thank you, Skip. Melissa?
I'd agree. Those were also things that I heard starting Friday morning. In particular, I heard from pharma biotech. I loved being able to sit and watch the whole session, and I think we all are guilty of jumping in and out of sessions. I will mention the juxtaposition that this allowed with life, whatever life may be for you. Here's my life there, and it allowed us to continue to be a part of our families, and for them to understand what we were doing, and that was rich for me. Okay,
Thank you, Melissa. Tatiana?
Yeah, so I'm a fan of telling my mentees that they need to know their greatest strength because it's also their greatest weakness, and it's only a strength or a weakness in the context of the situation in which they find themselves. And I think the same thing I learned was true about ASCO and this meeting. And certainly ASCO has a lot of strengths, but one of its unequivocal strengths is that it knows how to do an annual meeting, right? Like that meeting is fantastic every year in McCormick. It's the same way every year. And although the content changes and the people change, the faces change, the meeting as a whole is very much a familiar, successful product. And so I think that the challenge that we faced is, how do you take this totally successful product and get to the point of acknowledging that a lot of the things that are usually integral to its success aren't going to be able to be done? You're not going to have this beautiful week in Chicago where everybody's able to be together in one place. We don't have to think about time zones. We don't have to think about competing demands in our life because everyone's clinic is canceled and their families are home or in childcare. And by the way, I just have to say that I was so happy, even though my kids are now 12, 14, and 16, I was so happy a couple of years ago when ASCO instituted childcare and actually made it free for meeting attendees. I don't know what happened, but I did not get the free childcare in my home for the virtual meeting. And I don't know if any of you guys got that, but this was a real problem. So this was a challenge, that it's great that the content is all there and we can watch it. But the reality is it does become complex to do this meeting across a lot of different time zones when everybody's life is still going on in the background. And if anything, it's even weirder and more complex than usual because we do have maybe two spouses both working in the home with competing meetings happening and all the kids running around because school is closed and so on. So I think that that's a challenge that we have to deal with looking forward. But the flip side of realizing, okay, the meeting as we normally do it isn't going to be able to happen like that. Let's take this incredible expertise and energy that ASCO has about putting on a world-class meeting and say, how can we modify this in a way that will be compatible with the reality that we're all facing right now with the pandemic and not being able to gather. And so I think we saw some innovative things come out of that I can't imagine we're going to ever give up. And one of those was the recording of the poster, content by the poster authors. I think that was just an incredible innovation. It absolutely made the scientific program so much more successful and valuable than it would have been otherwise. Nobody really wants to just look at the poster, right? The value, if they did, we wouldn't have poster sessions at all. They would always just be posted on the internet. You could go look them up. The reason we have them in halls is that you want to have this exchange of ideas about them. You want to ask the presenter, how did they do this? Or what was hard? Or what's their next step? Or find a collaborator for a project. And so I think having that description of the poster available on demand on audio was really valuable. And I think that we should retain that. I know that the poster session is always crowded. You might be 8 people deep in back from a poster you really want to see with a 0% chance that you can talk to that poster first author, if you're hoping to get through the rest of the session at all. So I'm excited that we might have a thing, for example, at ASCO 21. And by the way, this has not been announced. I'm just simply saying I think it would be awesome. I think every conference should just have a QR code that you scan as you walk up, and you have headphones on the same way you would walk through an art museum, and you hear 4 minutes of something about that poster. And then you can decide if you want to stand there and talk to the author, or if you want to click on something and contact the author to make a time to meet up virtually or in person, or to have a conversation about a potential collaboration. There are so many things I think you could do with the technology there And none of that would have been possible were it not for the pandemic forcing this into a virtual format. So I think that, you know, we should be grateful for the ways that this has forced us to change up something that's so successful, because I think we all realize that the ability of something that's a good product to continue to be valuable and meaningful is critically dependent on its ability to evolve. And so the risk for ASCO in doing such a successful meeting is that it would be easy to just keep doing the same thing forever. This forced us to re-examine everything and say, how can we make this into an even better product? And I think that's going to be so great for the annual meeting going forward.
Absolutely great points. Thank you, Tatiana. Now, moving on, of course, the advantages of a virtual meeting were seen and they were evident. But now let's get on to the challenges that were actually faced in delivering a meeting of such a magnitude. So to start us off, Skip.
Thanks. Yes, there were a number of challenges, and one was just the absolute IT platform we had to put together. So the bandwidth, and it gets talked about certainly in the United States as well as other parts of the world in terms of whether we really are on a level playing ground with regard to broadband and ability to stream video and how that rolls. So again, a lot learned even between Friday and Saturday. And I think that'll continue to get better. But kudos to the ASCO digital team and the IT team for pulling that off. And then secondly, credit to Dr. Johnson with an example she did within the Carcinoma of Unknown Primary session, which was to actually film a live discussion with two of the participants. I do think it's been alluded to a few different times, a challenge of how do we in fact incorporate some of that dialogue, which is so vital between presenters. And so that's something we'll need to continue to work on as we go into knowing that a part of these meetings are going to be virtual for the foreseeable future.
Thanks,
Thank
Skip.
you.
I was gonna, that was gonna be mine. Kareem Fazazi and Tony Greco and I had a discussion that we filmed a week before ASCO, and we added it on. I think it really helped develop some of the themes and what I learned from that. And I think I shared with my ASCO partners was that it really helped solidify the take-home messages for the session. I agree that the live Twitter chat that was part of the plenary was fantastic, and if anything, there was a hello from all of these different parts of the world, and it was wonderful to know how many people were continuing, or how many people were joining from all over. But I was underwhelmed with some of the discussion. I felt like the discussion could be richer, and so in the future, a discussion, a medium for discussion, I think would be part of whatever's next. That's it.
Thank you. Don?
Yeah, I think Skip alluded to the challenges and the broad, broadcasting this kind of a meeting. It was a problem on Friday, and unfortunately, I couldn't get into the session that I was a part of on Friday, so couldn't really join in on the discussions if there were any. I think one of the things that was lacking, just to expand on what Melissa just spoke about, we had the opportunity to ask questions on the side while the presenter was presenting stuff, but I found as questions went up, you lost what were the prior questions, and there was no moderation of that, and there was no one answering the questions in some of those sessions that I attended. So I think that's an opportunity. I love the idea of incorporating a digital dialogue that's pre-recorded as part of this. I think when I heard it was going to go virtual, my expectation was at least plenary was going to be broadcast live, and I was wondering how we were going to pull it off. Now I understand that would have been an impossible thing to pull off, and quite a feat if we were able to do it. But there was this rich dialogue on social media, especially on Twitter, and I still harken back on this notion that really the vast minority of oncologists are on Twitter. And, if we could have just gotten more people to see what these discussions were like, we could probably further the educational mission of all of our society meetings. But, I think because of the fact that not everybody's on Twitter, we will always need to have a virtual, hopefully a live meeting, maybe a hybrid, to make sure everybody is hearing those really important take-home messages per Melissa.
Thank you, Don. And if I can chime in, that is something that OncoAlert has been doing. Of course, we have our presence on Twitter, but we also have the channels on Facebook, on Instagram. So what we were trying to do throughout the whole meeting is to get that content that we were getting from Twitter to our other followers that are on Facebook, because there is a lot of people from around the globe that are not on Twitter, but they are on Facebook or they are on Instagram. So we try to change the format, because you can't do the Twitter format for Facebook or Instagram. So we changed the format and deliver the same information. So, but I agree, it's a big challenge. Tatiana?
Yeah, I just wanted to comment about the networking issue, because obviously that's a tremendous part of what makes any medical conference valuable. The content, of course, is critical to drive future research efforts and improve care for our patients. But we could get the content without going. And the reason that we go is that the networking is really so valuable. And so I think that, as some others have already mentioned, if you were on social media, I think there was a lot of networking, if you will, that was happening anyway there. And I worry about the people that aren't. And I particularly worry about the people that really make very important contacts at the annual meeting and nowhere else, about how much their own work or careers could be set back. So I'm thinking about the fellows or the residents or even the medical students or even junior faculty who have their first poster, but now nobody's walking by their poster, at least not in any physical way. And they're not making those connections. I worry about the advocates that normally have the opportunity to connect with one another in the advocacy lounge and have physician and other healthcare colleagues going in and talking to them and doing trainings with them. I worry about the women in oncology networking area, the trainees networking lounge. Like, none of that has occurred, and none of that has occurred or will occur in a virtual meeting. And even though there was an attempt to have kind of virtual networking lounges, I don't know if other people have a greater sense of this, but the people that I know who did participate in those just felt like the format didn't really work, that the people who already knew each other were just talking to each other in a different room on their same computer screen as normal, and they weren't really pulling in the people who aren't a part of those electronic communities already, but who probably would have gone into the lounge or who probably would have been standing next to their poster. So I struggle with that a little bit, because I do think that we're at risk of leaving out the people that we always leave out and more when we do something in a virtual meeting. And I'm curious if others have thoughts about how we can engage them better. I know that I personally have found research collaborators, I've found job leads, I've found mentors, all sorts of very valuable things from the face-to-face contact that I've had at the ASCO annual meeting and other conferences. And I worry about this whole generation, if you will, if we think of a generation in terms of, say, fellowship length or something, or residency length, I worry about this whole generation that's already physically distanced from their faculty. What impact will this have long range on their career? I think we have to think about that, because this is not going to be over as quickly as we had hoped.
Thank you. Tawfiq?
Yeah, I think I would take it from there that the networking opportunity is really one of the, if you may, the icing on the cake when we go to ASCO. In addition to the education and the research presentations, I remember my first investigator-initiated trial came because I attended ASCO, and somebody took me to one of the pharma booths and introduced me to someone that led to the trial being funded. So that is really a great loss for our up-and-coming junior members, and which is why I feel, as great as the virtual platform is, it cannot be a complete substitute for the face-to-face meeting. Of course, there are very good aspects of it that will complement what the face-to-face can offer. The other thing is, now a lot of what we do as oncologists, whether in terms of investigator or even patient care, is global. And ASCO presents that opportunity for us to meet people that maybe you communicate by email. At times you're part of a multinational study where you don't actually ever get to meet the other investigators in person until you all go to ASCO. So that opportunity is limited. You try to do Zoom meeting and everything else, but it's never the same as having that face-to-face personal interaction. And the final point I want to make is, when you go to ASCO, everybody believes you're off. You're nowhere to be found. So they don't actually bother you with minor things. But when it is all virtual, you're actually at work. And I've had 2 instances now with ASCO and also with AACR, where my session that was meant to at least go up at a particular time, even though it was pre-recorded, that was when they paid me for a patient. And you can't say, oh, I have ASCO meeting, I have this meeting, I have this session I cannot attend to. So while that is minor in the context of everything else that we do, that is one potential drawback to the virtual platform and some challenges that we have to work around.
Thank you very much. Sorry, Melissa, go ahead.
No, that's okay. I'd like to respond to Tatiana makes some really good points about the importance of networking, but I think that and she makes a good point that we should not be fooled into thinking that we're going to be right back at ASCO 2019 when we get to 21, because I think we all can see the writing on the wall with respect to that. And so now we have enough lead time to make some changes. Networking, especially for junior faculty and medical students, has always started with some initiative on their part. When it was me, absolutely. And so I think it's just going to take some discipline for all of us to begin to think in a new frame. I mean, we've done actually some interviews over Zoom in the last few weeks for some open positions at Sarah Cannon that would have been done at the ASCO annual meeting. I remember when I was in ECOG and sat my little self down next to Tawfiq at the ECOG meetings, and I think that may not be possible, but I could interact with him in a chat form on a networking call for ECOG Akron Now, or maybe send him some sort of message over social media. I think if anything, it's the younger members of our field that are more adept to social media, be it Twitter or Facebook, and I think going forward, that'll be more and more important and an opportunity for our younger members. Just as an example, a young fellow my first fellow at Northwestern, he joined Twitter and tweeted over ASCO, and I hadn't seen him on Twitter at all. It was great to see him flexing his social media wings. And I actually thought that was maybe one of the silver linings, was that Twitter was a way that people could connect, as John mentioned, I think, and maybe Tawfiq as well. It's a good point that maybe not so many people were on Twitter. We have numbers to suggest that during the ASCO meeting, although it was 3 days, not 5. And so maybe that's the reason for that. But I think in years to come, it will be an increasingly important way to connect.
Thank you, Melissa. Tatiana?
Yeah, so just to comment on the social media, so I saw these data as well, that the number of tweets was lower for this year, at least for the scientific program, than we had last year. And of course, we haven't had the full ASCO meeting yet. We still have another few days of this to come in August. I think that by the time it all is said and done, we'll probably see at least as much or maybe more Twitter usage. I know that there was a lot less Twitter usage, at least that I saw from industry compared to usual. And I understand that there was some rules change. I actually don't know what that is that might have driven that last year, but I do think that was part of the decrease. I think the other piece of it that we haven't touched on in this, and it feels like wrong, honestly, to talk an hour about anything and not get to it, is the issue of what is going on in the background with issues of racism and protesting and so on. And I did see some tweets from people saying, I can't get on this ASCO 20 Twitter bandwagon right now because my mind is somewhere else. And so some of those people, I think, that might have been normally contributing to that online conversation were on Twitter. They just weren't tweeting about ASCO because their attention was understandably elsewhere. And so, that I think is a reality that we have to face too. And in the spirit of that, and in the spirit of thinking about equity, which so much of equity and healthcare has racism underpinning it, I think we have to think about opportunities to mentor and sponsor. And so when I think about who is still going to do, what Dr. Johnson said about taking that initiative and reaching out, certainly anybody's able to do that. But I would argue that probably white trainees and maybe white male trainees have a deeper network of mentors to rely upon in that way. And so I worry a little bit that in a virtual meeting, we may be disadvantaging people that don't already have deep networks. And that could be women, that could be people of color, that could be people at small programs versus large programs. I think that there are a lot of groups that could be international oncologists and low and middle income country oncologists. But I do think that there is a risk that having to move to the virtual format because of the pandemic, just as we've seen with the pandemic itself, will disproportionately harm the people that we were already disproportionately having harmed in society. So I think we can't leave that aside. And the question is, how do we then engage those people more on social media? How do we get our trainees? How do we get people of color? How do we get people from lower middle income countries? How do we get all these people on Twitter and then engage them and amplify their voices? Because I think that that is in some respects the best thing we can do to enable their continued networking, even when we're all physically distanced, and we might be for a super long time from the conference standpoint.
Mm-hmm.
Thank you very much, Athena. Don?
Yeah, so just to wrap up, just a couple of thoughts. I mean, I think, the whole annual meeting, I completely agree, with Melissa regarding how important it is to just provide those opportunities for someone who's a key opinion leader to talk to a junior faculty or even a medical resident who's looking to do oncology. And I've always said that I met everybody early on in my career standing at a poster or going through the poster sessions. And those initial meetings led to some really profound collegial relationships and also research opportunities. But it also did something else for me as a junior faculty member. And I think this is something I will credit Skip, and I know Lori's going to pick up that torch as well. But every single year, ASCO has done a little bit more to widen the opportunities to serve the organization, whether it be in a committee capacity, whether it be in a working group capacity. But these are essential, especially if we're looking at a new world where the annual meeting and the opportunities afforded by the annual meeting might be limited. To welcome people into ASCO as the organization itself, as junior faculty, as fellows in the leadership development training workshops, and all of these opportunities, these are Big 10, and they just have to get bigger, recognizing that, we need to identify those who are just really interested in helping the organization grow. And again, I've just seen sort of the tent open up more and less mystery about how someone serves on committee. And it's been really good to see. But, in the context of what's going on in the country, it was just striking to see how, we looked at featured voices and we put something out, a visual on our featured voices. We put a visual of who got awarded with research grants, and the big tent look of that spoke loads to, I think, society at large, that this was not a homogenous group. And I think we led by example in very, very subtle ways. And the nice thing is, all of the conversations from the annual meeting, they're still generating discussion. And so when people are ready to engage, social media affords them that record of discussion that they can just join in when they're ready.
Thank you so much, Don. Okay, now we, after this wonderful discussion, we moved to our last question. And here I would just like to talk about all the great ways that ASCO keeps involving patients and patient advocates to be part of the discussion. I wanted to see, does anybody have any thoughts? Skip?
Yeah, great topic. It is something where we're looking at it from a number of aspects. Obviously, one challenge always for patient advocates and patients, particularly those who are in the midst of treatment, is the travel and expenses of attending the meeting. And so, the virtual was a positive in that regard. We are also looking at and have begun to expand the number of opportunities for patients and patient advocates to participate in committees and on task forces with volunteer corps. There is a number of quick hitting topic issues that come up, and assembling a task force to address those and making sure we think about a patient being part of that. And then lastly, alluded to by several of the discussants today, we do have a number of very articulate, very passionate oncologists, regulators, executives in the pharma business who have also been patients, and actually hearing their voice and having them interact with the patient advocacy groups to really hear what they need. Dr. Prowl mentioned the military session we were going to have. There were some events surrounding that were also going to take place at the annual meeting to bring in that part of the patient community and that part of the professional society. So much work to be done, but again, it is front of mind. So it is something that we're continuing to discuss at the ASCO board level and with our various committee leaders.
Thank you, Skip. Tatiana?
Yeah, so I just wanted to highlight a few things that happened with advocates at the scientific program, the virtual scientific program, and that will carry forward for the for subsequent meetings. So one of those was the Grasp Tweets program, which is a program that was started by two women living with metastatic breast cancer, Julia Mouse and Christine Hodgson, and they debuted this, if you will, at the San Antonio Breast Cancer Symposium back in December. And basically, this partners scientists, clinicians, new advocates, and experienced advocates together in groups, and they go around and they view pre-selected posters that they, in the physical space would flag with a marker, and they would go and they would discuss the poster with the poster presenter. So the poster presenter would give a brief overview of it, and then all of them would react from their unique perspectives. And I participated in this as a clinician scientist mentor at San Antonio. It was so valuable. So they had planned to do this physically in person at the ASCO meeting, even though the physical ASCO meeting didn't take place. That process of Grasp Tweets is actually still going on. So they're still doing that. They just had one, I believe, yesterday, but they're being kind of dispersed over time rather than just happening all in one poster session or something. So I think that things like that serve two purposes. One is that they continue to provide patient advocates a voice in drug development, and they continue to allow that bidirectional learning between the advocates and between the people who are conducting the science or delivering the therapeutics that result from the science. But I think the other thing is that they also help to address this concern that I have about the lack of traffic to posters. And even though they don't go view and discuss every poster, if they're able to go draw traffic to the posters, that helps with this phenomenon of people doing all that work. They finally have their poster, in some cases their first poster, and no one's coming because there's not a physical place to come to. So I think that programs like that are really helpful. There was also a program that was started by the Tiger Lily Cares Foundation by a patient advocate named Mema Carmo, and she has these tweet-ups that are really about issues of health disparity related to cancer. She had one at San Antonio Breast Cancer Symposium in which I was faculty, and then another one here during the virtual scientific program that I took part in again. And those are things that there were sessions recorded over Zoom, and there was live chat, but there was also a long chat that went on for several hours. And so I do think that there are ways that we can continue to engage this community. And in fact, in some ways, it might even be better for patients because it's not demanding them to travel to another city, spending money they don't have, missing treatments they need to receive at a time that they don't feel well, and so forth. And it allows their caretakers to potentially be participants as well, which is great.
Thank you, Tatiana. If I could chime in, I wanted to give a huge shout out also to Christine and Julia, which are actually part of our OncoAlert network colleagues, along with Kelly, Lisa, so many great patient advocates. And we were actually very lucky from the OncoAlert side to actually have 15 of our colleagues participate in the Grasp Tweets in San Antonio, and it was magnificent. For me, it was just a beautiful experience. I was led by Roberta, also a great OncoAlert colleague. And we had a great time and a very wonderful learning experience from all sides, from the oncologist side, from the patient advocate side. So it was really great. We have started with our collaboration with Tiger Lily Foundation, and we, Mima reached out maybe about 4 months ago And we started with the Tiger Lily Foundation's OncoAlert tweet ups, and they have been really wonderful. So it's very important what we can do with our patient advocates, especially with social media. And of course, the engagement that ASCO puts in is great. Melissa?
Gil, I'll just add one sort of parting shot or parting thought about that. I think Tatiana really had some really substantive examples that are great springboards for us to learn from for the next meeting. But even a year ago, as we started to plan the ASCO 20 meeting, how we can be more inclusive of patients and patient advocates was absolutely part of every discussion we had. And I really look at the few patients who were invited speakers in this year's annual meeting as examples, to use Don's analogy of the camel getting its nose in the tent, because then the camel gets its head in the tent and its neck in the tent. I think that it is happening in so many ways, and we are hopefully influencing more and more opportunities for patients and advocates going forward. I think that the time is right.
Thank you so much. Well, that was a wonderful discussion. Thank you all. Does anybody have one last parting thought before we leave?
I'll just take this opportunity. We did a fundraiser during the meeting for COVID Impacts Cancer, really looking for engagement from all of our members, even just giving a few dollars, texting ASCO to 41444 or the conquer.org/ASCO to go to the website. But again, would love to see our members pitching in here with whatever little bit they can do to try to build up and get $1 million to use to help the COVID Impacts Cancer Fund. Thanks, Gil.
Thank you so much, Skip. And like I said, on behalf of OncoAlert, thank you so much for taking a Saturday to talk to all of us. Thank you so much, ASCO, for everything you have done for a wonderful meeting. Tatiana, educational, this is something that we're really looking forward to. So we know that you guys are going to hit it out of the park again. So thank you all so much. Enjoy your Saturday.
Thank you
for being
Join
here.
us August 8th through 10th. Don't forget, August 8th through 10th, education program. Bye.
Congratulations,
on the
everybody.
internet as well.
Bye,
Bye,
everyone.
y'all.
Thanks, Gil.
Bye.
Thank you.